The harsh but true reality is that low-income Americans who are diagnosed with diseases and illnesses are more likely to develop disabilities and to die than middle to high-income Americans. In America, there's an unsettling number of Americans who lack access to affordable, quality health care, and this issue must be addressed and must be addressed quickly. The thesis of this presentation is that the lack of access to affordable, quality health care in the United States affects far too many individuals. Today, I'm going to start by talking about first, why this is actually an issue. Second, I'm going to talk about how it can be addressed and different solutions that are possible. And third, I will talk about what can happen if these solutions are adopted. In order to start, I want to establish the issue of the lack of access to affordable, quality health care. There are a lot of researchers and writers and medical professionals that have devoted a lot of time into researching this topic. So to start out, a writer from the National Center for Health Statistics talks about how there are 28 million Americans right now who lack access to affordable, quality health care. And as if this isn't already bad enough, Janice Tane, who's an award-winning medical center writer, or medical and science writer, also goes on to talk about how each year 26,000 Americans die because of their inability to access treatments that they need to survive. And these aren't really big elective treatments or procedures. They're simply just treatments that middle to high income Americans do survive from. And that's really just an unsettling reality of our current healthcare system. There's another article from Health Affairs that talks about how not only do people lack insurance, there's also an issue with people who are just underinsured and their insurance plan fails to cover necessary services. And like I mentioned earlier, a lot of who this is affecting is the low-income Americans more than middle to high-income class Americans. And there's a Journal of Rural Health that establishes this just by explaining how rural communities are disproportionately affected with an issue like this. And so in summary, I've just presented this issue of the lack of access to affordable quality health care and have argued how it is a pressing, important issue and that it must be recognized and that we must recognize these people not just as numbers or statistics, but as real people with needs and with stories and with friends and families. And it could be easy to look at this and say, oh, well, 28 million Americans, that's about only almost 10% of the world, but of the US, but whenever you really take the time to think about the stories and the impact and the personal suffering of these individuals, and you take the time to personalize the issue, then it becomes a lot of a bigger deal. So now that I've established why this is an issue, I want to talk about how to find a solution. So Jennifer Talbert, who is a writer for the Kaiser Family Foundation, which is a research platform that basically their goal is to provide unbiased, just information, facts about different political issues. Obviously, healthcare can be a political issue sometimes. And so she provided some really interesting research that talked about how 73.2% of Americans that are uninsured are actually working. They have at least one family member with a full-time job. In addition, 11.5% of Americans that are uninsured have a family member with a part-time job. So essentially, there's 84.7% of these non-working or uninsured 84.7% of these uninsured Americans are actually working. And so in order to talk about a solution, I really want to focus in on this 84.7%. And I think that a very possible solution would be that states would expand Medicaid to their residents that are working. Donnie Lambeth is a Republican state representative in North Carolina, and he actually proposed this idea. And he talked about how not only would this help expand Medicaid and would help give healthcare coverage to more people, it also actually incentivizes people to work and in turn helps our economy because you know that if you end up working and you're putting something into the system, you're going to be guaranteed health coverage and access to affordable quality healthcare as a result of it. And so this is a proposed solution, and this Republican state representative, there's evidence that this is something that should be explored and could possibly work, and is something that needs to be further explored. So now that I've proposed the solution, I want to talk about how this actually could help in other ways. So there's a study done by the Commonwealth Foundation that talks about how expanding Medicaid to people who are working actually would end up creating over 1 million jobs. A lot of these jobs, about 50% of them, would be in healthcare, but they also would be in other industries like retail and construction and insurance. And so this really actually ends up benefiting the economy because you're creating more jobs and more people are able to work, and it's really helping to boost the economy. Another reason why a system like this would help is because of what it would prevent. And so I did some research, in the United States Department of Health and Human Services just had a lot of evidence backing up why a system like universal health care would not be a wise choice for a country like America. A lot of other countries have universal health care. Basically, the idea of it is just that the government comes in and they're like the single payer. And so healthcare becomes free and available and accessible to everyone, which sounds great in theory, but in reality, there's a lot of complications with a system like that. For example, wait times increase drastically. There's also a lot of de-incentivization between doctors as competition starts to go away, and also sometimes the quality of care can drop because of the number and the maximum influx of patients that are coming in. And so the more and more that we can avoid a system like universal health care, the better. But then if we can pursue a system that promotes work, that promotes healthcare, that promotes the economy, that would be really effective and would be incredibly helpful. So in review, I talked about the lack of access to affordable quality healthcare. I established why this issue is so severe and the gravity of the issue. And I also talked about the possible solutions that could affect this and help with this issue and the benefits of those. And so now it really is just up to us, and it's up to us to support policies that promote things like this. It's up to us to advocate for the quality of life of individuals who are vulnerable and susceptible and in marginalized communities. And it's really important that each person takes the time to understand who they're voting for and what they're voting for, and just promote action for people to really just be curious and ask questions and figure out what they're voting for and how to advocate for the vulnerable. And change must happen now. We need to stop the suffering of people who lack this access, yet deserve access. And it's time to act now to create a healthier future for tomorrow.